Hi, I'm Hisham Shalaby. I'm a foot and ankle consultant in Edinburgh. This is a video I made for my patients who have ankle instability and who are scheduled for a repair of the lateral ankle ligaments. The stability of the ankle joint is maintained by ligaments on the inside and outside aspects of the joint. Here we can see the ligaments around the outer aspect of the joint. The ATFL is one part of the lateral ligaments that is meant to prevent excessive front to back movement. This is the most common part of the lateral ligament to be injured. Injuries typically happen when you go over your ankle. You can watch my video on ankle sprains for more information about the acute injuries and how they can be best managed. Surgery is indicated for symptomatic patients who failed to improve with conservative treatment. These patients typically experience pain on the outer aspect of the joint and a sense of weakness and giving way. This video is meant for patients who are having primary repair of the lateral ankle ligaments. It does not apply to patients having revision or reconstruction surgery or those having other concomitant procedures like cartilage repair or bony realignments. Please be careful that each case is different. This information is generic. You must listen to your own surgeon's instructions. If you are unsure about any aspects of your treatment, you should consult your treating surgeon. This video is in no way a replacement for seeking medical advice when needed. The operation is usually done as a day case, but you need to be prepared to stay one night if needed. The operation is done under a general anesthetic and nerve blocks to numb the leg and reduce the postoperative pain. The operation is done through a curved incision on the outer aspect of the ankle joint. Sometimes we use a different incision, particularly if we need to assess or repair the tendons. The operation itself involves directly repairing the torn ankle ligaments. Harpoon-like structures called suture anchors are then placed in the ankle bone to offer strong suture attachment. These sutures are used to augment the repair by advancing a tough layer of the soft tissues called the anterior ankle retinaculum. This usually results in a very strong repair. At the end of the operation, the leg will be placed in a boot or a shelf plaster. In the post-operative period, it is very important to keep the leg elevated to prevent excessive swelling. You should be drinking plenty of fluids and doing regular respiratory exercises. You will have a follow-up in 2 weeks to have the sutures removed. You will be referred to physiotherapy at that point. Your next follow-up appointment is at 6 weeks, where the boot is discarded and x-rays are obtained. In the first week, you should not put any weight through the leg, and you will be using crutches to mobilize non-weight bearing. This is purely to protect the wound. After the first week, you can start putting some weight and build this up gradually. At the 6 weeks post-operative mark, the boot can be discarded and you can put weight fully in your own shoes. Physio usually starts between weeks 2 and 4 with core muscle strengthening and gait training. Physio can then gradually introduce exercises to regain range of movement and can also perform calf stretching exercises and strengthening exercises to the tendons around the ankle joint. A national protocol for the rehabilitation following the lateral ligament repair procedure has now been developed in Scotland, and your physiotherapist can access that on the NHS intranet or can contact my secretary for a copy. You can start using your normal shoes at the 6 weeks post-operative mark. These should be supportive shoes as much as possible and should accommodate possible swelling. Ideally, the shoes should be lightweight and should have a wide base to offer stability. If you are instructed to have insoles in your shoes, the shoes should have enough room to accommodate those as well. If you are working, the return to work will depend on the nature of your job. If you are performing desk-based duties and you do not need to drive to work, you might be able to go back as early as 2 weeks. If you have a more physically demanding job, you might need as much as 3 months before you're able to perform your job fully. You should request a phased return to your job in these cases. You can consider going back to driving after 6 weeks. You should only drive if you feel that you are confident enough. This is very variable from one patient to another. You must be confident that you're able to do an emergency stop, and you should inform your insurance company. Regarding sports, you can go back to walking short distances from 3 weeks. You can start swimming around the 6 weeks postoperative mark. Following that, you can introduce small increments of static cycling and build those gradually. If you golf, you can consider a couple of holes at the 12 weeks mark and again build up from there. You can consider the more aggressive sporting activities like football from the 6-month postoperative mark onward. If you sustained an ankle injury more than 6 months ago and you are still experiencing pain around the joint when you exercise or a sense of giving way and weakness in the joint, you need to be examined and investigated by a specialist. To complement this video, you should watch my video on the risks and possible complications of surgery. You can visit my YouTube channel called Orthopaedic World. You can also visit my website, orthopaedicworld.com, where you can read articles like how to decide about surgery. Thank you for watching.